Hello, my name is Dr. Jeff Emel, and I am a board-certified primary care sports medicine physician at Eastern Oklahoma Orthopedic Center, and I specialize in the treatment of sports-related injuries, conditions, and non-surgical orthopedics. In this video, I will be discussing ankle sprains. Typically, a patient who comes to the office with an ankle sprain will have complaints of pain and swelling over the outside portion of their ankle. This is often a result of twisting where the lateral ankle ligaments are stretched or partially torn. The most common cause of an ankle sprain is an inversion where the foot rotates inward relative to the ankle. This can result in stretching or partial tearing of the ankle ligaments. This often occurs in athletes on the basketball court or the soccer field, but it can also occur in the general population because of a fall or awkward step. Ankle sprains are usually seen in the athletic patient population as a result of high demands placed on the ankle ligaments. Athletes who participate in sports that require cutting, pivoting, twisting place a high demand on the lateral ankle ligaments. The pain that you will experience depends on how far you stretched or tore your ankle ligaments. Instability takes place when there is a complete tear of your ligament or a dislocation of your ankle. Patients will often report or feel a pop in their ankle, accompanied by pain and swelling on the outside of their ankle joint. This is sometimes accompanied by an inability to put weight on the ankle, which may indicate a higher severity ankle sprain or even an ankle fracture. When you are seen in our office, we will evaluate you from a clinical perspective as well as a radiographic perspective. Oftentimes, radiographs are needed to ensure that there is no fracture or break in the bone. The most common type of ankle sprain is the lateral ankle sprain. There are three different grades of ankle sprains. The first grade is a minimal sprain, which results in minimal tenderness and swelling in your ankle. This means you have microscopic tearing of the collagen fibers in your ankle ligaments and will need to do extra stretching to relieve the pain. The second grade of ankle sprain is moderate. This grade of ankle sprain results in moderate tenderness and swelling with a decreased range of motion and difficulty standing on the ankle. This means you will have a complete tear of some, but not all, of the collagen fibers in your ankle ligaments. You will be given a splint and you will undergo physical therapy to heal your ankle. The third grade is a severe sprain. If you have experienced a severe sprain, you will notice significant swelling and tenderness, and you will not be able to put any pressure on your ankle. A severe sprain causes a complete tear or rupture of your ankle ligament. Your ankle will be immobilized to allow the damaged tissue to scar back down to its normal length. After your ankle is immobilized, you are started on range of motion exercises, strengthening exercises, and proprioceptive exercises. Surgery may be needed in severe cases. Other ligaments in the ankle can be injured with a lateral ankle sprain, such as the ligaments between the fibula and tibia, the ligament complex on the medial side of the ankle, or an injury to the cuboid calcaneus joint may occur. Treatment for an ankle sprain typically includes RICE, which stands for Rest, Ice, Compression, and Elevation. The majority of ankle sprains can be treated in this manner, and most are resolved between a period of several days to several weeks, depending on the severity or grade of the sprain. Patients who have experienced an ankle sprain are usually able to return to activity anywhere from 2 weeks to 2 months following their injury. It's important to take time to rest the ankle and perform range of motion exercises as well as strengthening and proprioceptive exercises in order to achieve a full and successful rehabilitation. In conclusion, it takes 6 months for all the ligament fibers to repair. Therefore, high-risk activities such as sports will require protective bracing. To learn more about ankle sprains, please visit our website at eooc.com. Thank you for choosing Eastern Oklahoma Orthopedic Center.